and new this week, everyone. Tina, you can take it away whenever you're ready.
Great. Thank you so much, Daniel. Thanks for coming, everybody. Good morning or good afternoon, depending on where you are. It's really nice to see everybody. Oh, we have a really good group. I'm kind of watching a screen on my side as people are joining the room. So this is wonderful. I hope you're enjoying the COPRH conference so far. I've been really enjoying it, and I'm excited that you're here. The topic for this breakout session, which is going to lead into a second breakout session that Brian is going to be leading right after this, is identifying multi-level contextual factors. So my name's Tina Studts. I'm an associate professor here at the University of Colorado on the Anschutz Medical Campus. I'm in pediatrics, and most of my research is on implementation of evidence-based interventions in underserved or vulnerable populations. So I do a lot of things with parenting interventions in rural settings specifically, or with populations that haven't received evidence-based parenting interventions before. But I also am really lucky through my role with Accords here at University of Colorado to collaborate with a ton of investigators on lots of different topics. So when we get to the end of kind of the didactic part of this presentation, we're going to try to have time to do an exercise, which is going to be focused on lung cancer screening, which is one of the areas that I've been lucky enough to learn about and be able to work with, and thinking about how contextual factors influence the success or lack of success of implementation, how they influence what you have to plan for, what your implementation strategies might involve, what adaptations you might have to make to your intervention. These are all the types of things that make it really important to be thinking in a multi-level way of what implementation factors or contextual factors you might be addressing in your research or your practice. So what we're going to cover in this session, it's a little introductory. So if this is something that you're super familiar with, bear with me and maybe share a lot of your expertise when we get to the exercise. We're going to talk about a brief overview of context and what context is. We'll talk about ways to organize our conceptualization and our understanding of context using specific frameworks. And then we'll do a practical application of a very simple framework to identify contextual factors at multiple levels that might be relevant to implementation of an evidence-based practice. And in this case, it will be lung cancer screening. So for this brief overview of context, one of the ways that we can define context is that if you are implementing an intervention or a practice or a policy, whatever it might be, context is everything except for that intervention, that policy, that pill, one of the P's that you might be actually trying to deliver in a specific setting. So if the goal of implementation science is to facilitate uptake of these practices, policies, programs, we have this overarching question always, which is when, where, how, with whom, under what circumstances, and why does the thing, to quote Jeff Curran, work? And so the thing could be an evidence-based intervention, program, policy. It could be implementation strategies that you're using to implement an evidence-based intervention. And so if you have seen Borshika Rabin talk about this, this is one of her favorite quips, is that context is king, but context is queen, and she runs the household. So we have to really understand context to be able to plan for, implement, and then sustain the delivery of evidence-based interventions in real-world settings. So one of the things to keep in mind about context, well, multiple things to keep in mind, is that context isn't just one thing, and it isn't static. So contextual factors can be found at multiple levels when we think about implementing an intervention. A really easy way to think of this kind of goes back to public health and the social ecological framework. This is not specifically a determinants or contextual framework in implementation science, but all of the all the determinants and contextual frameworks in implementation science rely in some way on the social ecological model, in which we have individuals nested in relationships, nested in organizations, nested in community contexts, and then nested within structures, policies, and systems. And one of the things that is sometimes not explicitly acknowledged is that there's also an element of time. And so all of these levels of the contextual setting or the context for an implementation effort these things change over time as well. So the best and most recent example we have of this is COVID, obviously. So if we think about efforts in the past to implement things like telehealth, there were contextual barriers at multiple levels to implementing telehealth. And rapidly, because of changes in multiple levels of context, suddenly telehealth was able to be implemented and potentially sustained for a long time. We'll see what happens in the future. But that's because the context changed. And so when context changes, that actually affects your implementation of a specific intervention as well. So it's important to keep in mind that context is multi-level, like the socio-ecological framework is a really nice way to look at that. There are multiple domains that might be within each level or across levels. The levels and domains are interactive. And so this gets really complicated in thinking about how individual level contextual factors might interact with, for example, organizational level factors to either promote or hinder the implementation of an evidence-based intervention, and then they're dynamic and change over time. So when we think of that dynamic nature of contextual factors, this is just sort of a thought slide. So if we think of the planning phase, the implementing phase, and the sustaining phase of implementation, at each level, you're going to have contextual factors that may influence how well your implementation goes. And those things may change over time and with respect to how relevant they are to implementation, as well as what their impact on implementation is. So are they a barrier or a facilitator? So this slide is not for any specific contextual factors or implementation efforts, but just to demonstrate that something that might start off as a facilitator might actually turn into a barrier later. And something that's a facilitator in the beginning may continue to be a facilitator across time. And those things may differ depending on which level you're looking at, what domain you're looking at, and what specific contextual factor you're looking at. A couple of other concepts that I want to hit on quickly are plasticity and elasticity, which is from a Mays article from 2016. And this concept I really like. And of course, if you know me, I'm a cat person. So this particular photo I also really like. So sometimes it's the context that can give and take. And sometimes it's the intervention or the implementation strategy that has some give and take. What we want is to see these things kind of meld together so that the fit of whatever it is that you're implementing or the manner in which you're implementing it is a good fit for your context at multiple levels. Some contextual factors that might be barriers or facilitators might also not be easily modifiable, which means that the intervention or the implementation strategy is what has to kind of squish into the plastic box. But the flip of this might be that the intervention itself might have some components of some aspects to it that are not easily adaptable, and thus the context would have to be the thing that is modifiable or addressed with strategies to make the intervention fit into it better. So this concept, I think, of plasticity and elasticity is important to think about, especially in terms of contextual factors at different levels and in different domains at different times that may or may not be modifiable. So this is something to think about when you're actually identifying contextual factors in practice or in research. So now that we hopefully have sort of an overview of context and a way to think about it, there are many frameworks in implementation science that are used to conceptualize and organize this idea of context. And they range from very simple, like the sociological framework that I just mentioned, to much more complicated and comprehensive. So they're often referred to in the literature, if you're reading about context, as either contextual frameworks, sometimes as determinants frameworks. And one of the defining kind of characteristics of all of these frameworks is that they allow for contextual factors to have all of these characteristics that we talked about when we were first talking about context. So they're multi-level, they all include multiple domains, they all acknowledge that these contextual factors are interactive across levels and within domains, and also that they're dynamic and can change over time. So a simple framework, again, would be this one. And this is actually what we're going to use in the exercise, because it means that we don't have to be tied to the specific constructs or language that's used in a specific framework, and we can just think about levels. But when we look at a more complicated framework, this one is the diffusion of innovations in service organizations, which has kind of undergone some changes over time, but this is Greenhall's framework. And if you look at this, we basically have the innovation or whatever it is that you're trying to implement. We have diffusion, dissemination. We have the system in which we're hoping to get the thing implemented. And then if you look at all of these kind of aqua colored boxes all around the figure, these are all different aspects or domains or levels of context in which there are multiple things listed. So if we look, for example, at the outer context, in this particular framework, we're thinking about the socio-political climate, incentives or mandates for performing or delivering an intervention, interorganizational norm setting and networks, environmental stability. So we will see these things in other frameworks as well. There are like parallels between the frameworks. They tend to use their own language, and they're all set up with their own kind of organization and their own domains, and to some extent, some language in common, although some of them have some very specific terms that they use that differ from others. But if you look at this, you can get an idea of how comprehensive and complex a contextual framework can be. Which then leads you to the question, if there are multiple of these frameworks, how do you know which one you should use? So if you have not already visited this resource, and I hope that most of you have, disseminationimplementationorg is an excellent website. Borshika Rabin has developed it and with colleagues keeps it going and adds to it. It keeps it updated. And basically on this website, if we have time later, we can look at it. You can find contextual models, determinants models, and frameworks. You can search for specific constructs within models to help you identify a model or a theory or a framework that you want to use. You can access kind of some practical hands-on examples and instructions about how you might combine or adapt theories or models or frameworks to use when you're thinking about context. And then there's a link to the NCI D&I GEM website where you can look for available measures that might actually already exist to measure some of those constructs that you're interested in when you think of contextual factors. And when we get to the next breakout session, if you stay in this 2-session series, Brian is going to be talking a lot about assessment and measurement, like how you actually assess these things, not just identify them as we're doing in this session. So there are 3 specific contextual frameworks that I'm going to talk about because these are used a lot in the literature if you're not already familiar with them. And I'm just going to give you a little bit of an overview of what each of them addresses in terms of multi-level context. So the first one is CFR, the Consolidated Framework for Implementation Research. Many people will be familiar with this because CFR is used a lot. It's been around since 2009, I believe. It is a compilation or an integration of multiple frameworks, theories, and models and constructs that were used to describe context in different disciplines for a really long time. So basically it took all of this information together to put it into one consolidated framework. And some advantages of this framework, CFR.guide.org. CFRguide.org is a really helpful website the developers of CFR maintain that has a ton of resources on it, one of which includes a PDF or HTML version of basically all of the constructs that are within CFR so that you can look them up, you can see the operationalization and definition of each construct, and you can think about how that might apply or not apply in a project that you're either implementing or researching. So in CFR, we basically have 5 domains in which we think of contextual factors. So these are the intervention itself, characteristics of the intervention, the individuals who are involved in any type of implementation activities, the outer setting. So if you're working, for example, in a hospital system, the outer setting might include the geographic region, the state, the local economy, policies, resources available outside of the system. You have the inner setting, which is what we typically think of as the organizational context. And we'll talk a little bit about what things you might be interested in within the inner setting. And then there's a domain, which is actually the process of implementation. And so this includes things like, how was the implementation rolled out? Was there stakeholder engagement from the beginning? How was buy-in obtained? There's just a whole bunch of stuff about kind of top down, bottom down, or any combination of ways that implementations are rolled out in real life. And so process is the domain that captures those factors. So one of the challenges of COPRH is that it is very comprehensive. And so under each of these 5 domains, there are multiple constructs that you might look at. And the challenge can sometimes be deciding which of those constructs you actually want to assess and which ones you want to consider in your project. So one of the main things in most of these, well, all of these frameworks, and hopefully as you've picked up in other COPRHCon sessions, stakeholder engagement is one of the best and most important ways to figure out what you should be paying attention to in terms of context. So from the very beginning of an implementation process or planning period, you would want to be talking to the individuals involved and people across different levels, like the outer context, the inner context, the people who will actually be involved in implementation, the people who will be receiving the intervention, and get their perspectives on contextual factors that are going to be important to consider in implementation. The other thing about this particular the figure that is used here for COPRH that is interesting to think about is that the intervention itself, if you have a plastic or a not very adaptable intervention, you sometimes may end up with like a poor fit between your intervention and your context, or if your context is very rigid and difficult to change. Whereas if you are able to make changes to either your intervention, your implementation strategies, or aspects of the context, you can end up with a much better fit between your intervention, your implementation strategies, and the context in which you are trying to implement. So it's a nice way to kind of remember that plasticity, rigidity sort of differentiation. The second framework that I'm going to talk about briefly is Prism. Prism stands for the Practical, Robust Implementation and Sustainability Model. It was developed by Russ Glasgow, who also is a developer of Reaim. And one of the things that the projects that I personally have worked on that have used Prism, one of the nice aspects of Prism is that it incorporates Reaim outcomes within the framework itself. So the idea here, similar to COPRH, is that we have multiple domains in which there are contextual factors that are going to influence the implementation of whatever practice it is that we're trying to implement. And all of those domains in the Prism framework relate directly to Reaim outcomes. So if Reaim is something that you are familiar with and you already use, one of the nice things about Prism is that it incorporates Reaim outcomes like explicitly into the framework. So we have characteristics of the intervention, very similarly as we did in COPRH, and there are multi-level organizational perspectives on the intervention as well as patient perspectives. We have recipients of the intervention and also implementation strategies. So these are individuals within the organization at different levels who are recipients of implementation strategies to deliver the intervention, as well as patients who are actually the recipients of the intervention delivery. We have aspects of the external environment. So this is similar to the outer setting in COPRH. And then we have this pretty crucial box here, the implementation and sustainability infrastructure in Prism, which captures things like leadership engagement and resources and buy-in and presence of champions and all of those types of kind of organizational culture or implementation facilitators and barriers in this particular box. So one thing I wanted to point out is that Reaim has a pretty extensive website that is a helpful resource to people who use Reaim in both research and practice. And we're currently working right now on integrating Prism into the reaim.org website in case you're looking for more resources on Prism. I also included a couple of citations for Prism that have been both its development and also this McCrate article right here, which is an application of Prism across 4 different studies in the VA. So it's really a helpful article to see how it might be used to assess multi-level contextual factors. The third framework that I want to highlight is Epis. And Epis is the Exploration, Preparation, Implementation, and Sustain framework. One of the things that, well, there's a couple of things that make this unique in comparison to the others. One is that it really explicitly includes the dynamic nature of context. And so in thinking of the exploration, preparation, implementation, and sustainment phases, Epis builds that directly in. So the other models can certainly be used at each phase of the implementation process, from planning through sustainment, but Epis actually includes that in the framework itself. So it might be helpful if you're specifically thinking about dynamic context or how different contextual factors come into play at different phases. It also includes, as you can see here, the outer context, the innovation factors. So this is sort of like characteristics of the intervention. It's got constructs under the inner context. And then it has this interesting bridging factors about how implementing agencies and organizations explicitly bridge to the outer setting. So this would be things like payers or policymakers or intermediaries. And so this framework also has an excellent website. I highlighted a specific page on it that provides some measures to measure some of the constructs that are within the Epis framework. And I want to talk about why you would use these. So, we can think about contextual factors pretty easily when we do this brainstorming exercise in a minute. I think we're going to come up with a lot of things to put in it. But the reason that you might want to use frameworks as you examine and consider and assess contextual factors. So first of all, you might have an idea, and your stakeholders have kind of told you what they think barriers or facilitators or important contextual factors are to consider. You might sort of know this going in. And so one of the outcomes or benefits of using a framework like this is that you might just verify what you expected. So you might actually discover, yes, we were right. It's training. We need to do training because the individual characteristic of like low levels of knowledge or relative priority or the lack of skills, this is the thing that is really going to affect the implementation. So you might verify what you expected. But I think more importantly, you might consider factors and levels that you hadn't thought of before. So we all, this is why we have stakeholder engagement. This is why we involve the people who are actually involved in the implementation, the decision-making in our projects, that you may not have thought of certain factors and levels going into it. And these frameworks can push you to do that because all of them are multi-level, all of them have multiple domains, all of them recognize the dynamic nature, and all of them recognize interactions among levels. So it just helps you kind of get out of whatever box you might be in and think about factors and levels that you may not have thought of before. You can also identify modifiable contextual factors that could actually be targeted with implementation strategies. And on the flip side, you might be identifying non-modifiable contextual factors that mean that if you're going to successfully implement and increase that fit between the intervention and the context, you may be needing to adapt your intervention or your implementation strategies to make that work. These frameworks will also help you assess relevance and importance of contextual factors over time. And then ultimately, the idea here is that if you understand these, you'll be informing your plans for implementation, sustainment, scale up, and scale out, which is really the goal. So we're going to do an exercise. And this exercise is going to be based on a specific scenario. Let me check our time. We have like about 12 minutes. And so I'm going to let us take probably about 10 minutes to do this exercise and wrap it up, and then give you just some concluding thoughts before we move on to the next sessions. What I want you to think about is this scenario. So in lung cancer screening, low-dose CT lung cancer screening has been shown to reduce mortality from lung cancer among individuals who are at high risk for developing lung cancer. It was identified as an evidence-based practice back in 2015, but it has really been inadequately adopted and implemented in community settings, specifically in hospital settings. And so there are many teams who are doing implementation research on LDCT and seeking to understand the contextual factors that are related to the adoption, the implementation, and the eventual sustainment of low-dose CT lung cancer screening to increase its public health impact. But when you think about implementation of lung cancer screening, there are a lot of things that go into it. So anybody who's involved in any kind of cancer screening research or other screening research may have some insights into this. What we're going to do for our activity right now, hang on a second, I'm going to pull a screen over, is brainstorm possible contextual factors that should be considered or may be important in the implementation of low-dose CT lung cancer screening in community settings. So what I want to do is give you on your own about a minute to think about this. And our goal here is to fill in as many potential contextual factors as we can think of that would fall into these levels. And you may think of some things that don't fit into a level specifically. An example of that would be, well, I don't want to give you a leading answer, but an example of this might be something like a characteristics of the intervention in CFR. So its complexity, for example, or its resource requirements or something like that, like instrumentation that you need, for example. And so that might not fit into these, but could fit into this catch-all category. So what I'm going to do is be quiet for about 2 minutes, let you think, and then have people start chiming in so that we can fill in this table. Okay, so think starting now. Okay, that may or may not have been 2 minutes, but I think that's good enough. So if you would like, I would love it if people would just unmute, and I'm going to have trouble watching the chat while I do this because I'm going to type. But if people would unmute and share with us specific contextual factors at any level that you can think of that are going to be related or you think are going to be related to the successful implementation of lung cancer screening. I'm here to type.
Tina, what about stigma of tobacco use as a, I think I would put that as, yes, at least individual might even be considered somewhat of a norm or interpersonal.
I think it goes everywhere.
Does it go everywhere? Okay, thank you.
I really think it does. I mean, so if you've done work with lung cancer screening, stigma is a huge issue, and it permeates, it permeates policy, like patients' willingness to participate, physicians and staff's kind of attitudes about patients with lung cancer screening. I mean, it really permeates. So maybe it belongs here, like at the societal level.
Is that kind of like I hit the jackpot? I'm feeling really good about my answer.
Good one, Amy.
You get the prize.
I know. What are some other thoughts you guys have?
Kind of along similar lines, but maybe on the individual level, like perceptions of risk or levels of health literacy.
Nice, yes.
I have similar ones, but they were taken. The next one would be access, particularly in rural areas, distance, and cultural barriers. So that also limit access, but they are different things. So the access would be organizational, individual, and
maybe like a transportation barrier as an individual level, and then access at a org level like you've got.
Yeah, or geographic. Yeah.
It's always easy, I feel like, to come up with like the lower level sorts of barriers, which is why we do exercises like this, is to try to force us to think of the higher levels as well. So when you think about organizational, maybe societal and policy type issues, what contextual factors can you think of? We can add more at the lower levels too. I'm not shutting you down, but if people can think of some that go at the higher levels, that would be great.
One that I think may fit in that category would be, is this reimbursed? Are they actually getting extra money coming to their organization or facility for doing this screening, or is this something that they're having to absorb the cost of it?
Yep, that's a really good one.
Yeah, and along those lines also, the cost associated with treatment, should anything be discovered, because you could do a free screening, but then who's going to cover it if they don't have healthcare coverage?
Yep. That also probably goes in the policy.
Also, like appropriate follow-up care if something is identified, just the availability of that.
Because I mean, this is the idea that you don't screen for something that you can't do anything about, right? So from an organizational level, you have to feel pretty confident that if you get positive screens, that you have adequate access to treatment for your patients. I think personnel. So one thing I didn't mention when I gave you the scenario is that lung cancer screening programs aren't just the screen, like just the scan, right? There's like a whole bunch of stuff that goes into it, like shared decision making. There's tobacco treatment specialists in case you need them. There's in certain places radon mitigation. I gave you, if you look at the handout, there's a Kentucky Leads, which is a project in Kentucky, full disclosure, led by my spouse, which focuses on lung cancer screening in across the state of Kentucky. And there are a lot of things that go into a screening program, not just the actual CT scan. And so personnel and resources are pretty big contextual factors that are associated with whether an organization can do this successfully or not. Do we have any sadly empty boxes that people can think of some additional multi-level contextual factors?
Well, at the community and interpersonal would be both the stigma of tobacco use and the normalization still in some areas of the tobacco use or norms.
Yeah.
Maybe fatalism
or
along with
tobacco
those
and
norms.
now the alternatives.
Yep.
I can say from the primary care perspective, the ease of identifying those who meet the screening criteria in a feasible way, in particular former smokers. Often current smokers are easier to track, but former smokers aren't always as administratively available in the database.
Yep. Excellent. Okay, I'm looking at our time. We have like about a minute and a half left. And so I'm gonna swat. This was really good. I mean, just to kind of like get your brain thinking about levels that you don't necessarily always think of. Let me switch back just to a final slide on here and then kind of leave it open for any last comments that people might have. The things I want to leave you with, first of all, are that context is queen. You know, we have to think about context, that we have to think about multiple levels of context, that the use of frameworks can actually help you identify relevant contextual factors, which are relevant, which are barriers, which are facilitators that may all change over kind of the course of implementation. And these factors could both be targets for implementation strategies or conditions that require adaptation of your interventions or implementation strategies, or just helpful, you know, as we think about social determinants of health, sort of as a parallel way of thinking of contextual factors, they just help us understand where, when, how, with whom, under what circumstances, and why a thing works or does not work. Also in your handout, which you can download from this session, there's a list of resources that I hope are really helpful to you, just to kind of help you explore context and frameworks a little bit more. And with our remaining, 10 seconds, I will say thank you so much for coming. Thanks for engaging in the activity. And Brian's session right after this one in about 5 minutes is going to talk about measurement. So if you're interested in this, you should stick around.